Hi everyone, Dr. Adrienne with Healthy Living Chiropractic, coming to you live on this Thursday. We are talking today all about concussions. So concussions in chiropractic care and how it is that we can help out when patients are dealing with these types of injuries. So we're going to discuss kind of what is a concussion, what types of symptoms one can experience, what types of things chiropractic care can do about it, what things we can do in our office, and then I'm going to end with a personal story with what our family is doing dealing with a concussion personally. So here we go. All right, so a concussion is basically the most mild form of a brain injury. It is essentially a bruise or a contusion on the brain. There's varying degrees of them. They can be from mild to severe, and it occurs when there is a blow to the head or when the head is moving or the body is moving and stops suddenly. So it can happen in a car accident, it can happen in a sports injury, it can happen with a fall. So any of these things where the head is moving in a speed and all of a sudden stops suddenly can cause a concussion. The brain is basically a big mushy kind of organ. It's an extremely important mushy organ, but this brain is very soft and it's enclosed in a very hard skull, like a shell. So when the body's moving and the brain's moving and it stops suddenly, it can bounce off of the skull, which can then cause some bruising and cause some damage. And so that essentially is a concussion. So over 3.8 million concussions occur in the United States. Those are the ones that are reported. I'm sure plenty happen that are not reported to medical facilities. And over 100,000 of those happen to children. So any sort of injury with a growing brain is a big concern because we want to make sure that we can handle it and heal the brain as best as we can, so that child can continue to grow, and to heal. The problem, well, there's a lot of problems with concussions, but the biggest one is you can't really see what's going on. So it's not like a typical ankle sprain where you can see the person is in the boot, you can see the swelling, you can see the issue, you can see the problem. With a concussion, you can't necessarily see it. The only thing that you can do is evaluate the patient, and it's what they're experiencing is it determines the severity and how well it's healing. So it's a lot harder to track and to manage, and there are people and physicians that focus just on those, and those are definitely the experts at those for sure. So some of the symptoms that we'll see, kind of the big things, are things such as headaches, dizziness, loss of consciousness, so kind of not being able to stay awake, problem sleeping too much, irritability, problems with mood changes. So those are all big things. Headache, I think I mentioned headache, neck pain, because oftentimes if it happens with a whiplash injury, you can then have injury to the neck too. You could also see things such as vision changes, blurry vision, problems reading, problems concentrating, as well as nausea and vomiting. So those are all really common symptoms of concussion. Again, they can come in various degrees and severity. There's a lot that chiropractic can do about that. So while, yes, the brain is enclosed in the skull, there's not a lot we can do with that. We can do a lot to affect the cervical spine. So every time there is enough trauma to create a brain injury, there is a trauma that's created. There is almost always a cervical spine injury. Your cervical spine is your neck, okay? So when there is, I've got my little model here, when there's an injury to the brain, like I said, the neck is almost always involved. This is a model that kind of shows the back of the skull. Right here is C1. So C1 is the top vertebrae right there. On me, it's right underneath my ear. That is C1. That basically is in contact with and right near the brainstem, and that's where a lot of the cranial nerves are that go to your eyes, that go to your ears, that go to your face, to your senses. Those are really, really important. So what C1 can do is by adjusting that area, obviously very gently. After a concussion, it's usually very sensitive. We can go ahead and apply a little bit of gentle pressure to that area, and that can help it to move better, to feel better. There are also some blood vessels that come through there. I'm not sure if you guys can see this or not, but there are some blood vessels that come down from the brain through the C1, the first cervical vertebrae. So if that is turned or twisted or moved just a tiny bit, it can cause some pinching or compression of that blood vessel, which then brings blood to the brain. In addition, brings blood away from the brain. So anytime there is trauma, or an injury or inflammation, there are waste products that are produced. Those waste products kind of hang out in the brain for too long and aren't able to drain properly. That can be a problem. So adjusting the upper cervical spine is really important with allowing proper drainage of the brain, proper blood flow to and from the brain, and also helps to help out with the cerebral spinal fluid, which is kind of the water and fluid that's around the brain, helps that to flow as well too. So getting adjusted is very, very important. All right, so yes, obviously we will adjust the spine. That is kind of the number one thing we do. We take a lot of gentle care with the concussion patients because they're generally very sensitive. A lot of times in our office, we will do cranial work, which is doing really gentle work on the head, essentially the cranium, which can then be very comfortable for the patient, but also very important with like the things I was talking about with C1, getting things to drain. Like I mentioned before, I am not a concussion specialist. So if I do have a patient that has a concussion, I'm going to refer them out and make sure they see a concussion specialist in order to do proper physical therapy to manage that concussion. I will co-treat along with that other practitioner to help the patient to obviously have their best results possible. The big thing that we do too as well in our office is do a lot of supplementation. So the personal story, I'm just going to jump into this right now, is my daughter, my 11-year-old daughter, had a concussion playing hockey about 2.5 weeks ago. She was checked, which you're not supposed to check in girls hockey, but she was checked. So she was hit from the front and she hit the back of her head on the boards. She had a helmet on, she had her mouth guard in, all the things, but she hit it just right where she fell and then kind of got off the ice, was crying, had an instant headache right there. Her coaches did kind of the general concussion checks, kind of checked her memory. Where are you? What do you feel? She really didn't know a lot of where she was. She wasn't able to tell what day it was. So we're like, okay, she's out. So we took her back into the locker room. We did kind of some general, a little bit of balance stuff. We did a little bit of just kind of calming her down and helping her. But nonetheless, she had a concussion. We did go to the ER. We got an evaluation. She then started care with a concussion specialist. And the mommy got to work. Dr. Mom got to work right away. So we established she did not have a brain bleed. So you don't want to really do certain supplements that decrease inflammation when you have a brain bleed. So we obviously ruled that out. But the first thing we did is we got her some arnica, which is a homeopathic remedy that is great for anti-inflammation and decreased pain. So anytime there's bruises or any sorts of injuries in our house, we grab the arnica. So that is something you can get at your local co-ops. We don't carry them in the office. They're only, $6 or $7 for a bottle of arnica. So I definitely recommend that. But fish oils was kind of my first go-to, was to really start getting that inflammation pulled out of there. So we got her on those right away. In addition, I've got some supplements, one called Inflammatone, which is a homeopathic remedy that basically helps to decrease swelling, decrease blood flow, kind of helps the body to start healing and processing things. So Inflammatone is one thing we had her doing right away. And then the other piece was to start supporting the brain. So a couple products from Standard Process, Neurotrophin PMG is basically the brain go-to, as well as ribonucleic acid is another one, again, to help to strengthen and support the brain while it's working on healing. The biggest piece is with any injury is decreasing inflammation is number one, and number two is help to strengthen and support. Obviously, we had her calming down her screen time. She was reduced in school. She's obviously not doing activity, but getting that supplementation we did pretty much right away. This is another new product we carry from Apex called Neuroflam. It's got turmeric, resveratrol, and a bunch of other herbs as well too, to kind of help with healing, reducing that inflammation, helping to support the body. So obviously we do a lot of supplementation in our office, and just wanted to share with you kind of what types of things we're doing. She's doing PT. She's doing fantastic, except for she's still got some balance issues, and the biggest issue that she's dealing with is with her eyes. So we're seeing a vestibular therapist right now, so she's getting the care that she needs. Of course, mom's adjusting her and doing cranial work on her and getting her supplements and her exercises in. So just wanted to share that with you. If you have been dealing with concussions, or if you have colleagues, friends, people that you know that have dealt with a concussion, I would love the opportunity to evaluate them, because like I said, every brain injury has a cervical spine injury component to it as well. Would love to help to co-treat, do what we can to help support them. Just this month in our office, we are offering a really fantastic deal on new patient evaluations. They're only $47, which is insane. So I'd love the opportunity to check with you, or let me know if you guys need anything. Please, like I said, drop something in the comments here, or reach out to our office so we can get those appointments scheduled for you. So hope you guys learned something today. If you have any questions, please let me know, and I hope everyone has a fantastic Thursday. Bye.